I'm Renee.
And I'm Tina, and we're back with another video for you. Today we're going to talk about different types of acne and what's the best way to treat them.
But before we begin, don't forget to click subscribe below so you can get weekly skincare tips from us. So let's get started with what actually causes acne.
Acne can be caused by things like bacteria, hormones, excess oil, and dead skin cells.
And even though acne is mostly tied to teenagers, it's a really common skin condition and can actually affect people of all ages.
There are two main types of acne, inflammatory and non-inflammatory. Keep in mind that you can have more than one type of acne at a time, and if you're dealing with serious acne, you should probably consider seeing a dermatologist first. Let's start with non-inflammatory acne like whiteheads and blackheads. These generally don't come with any swelling, and they generally respond well to over-the-counter treatments.
Products with salicylic acid work best for non-inflammatory acne.
We love the COSRX Salicylic Acid Daily Gentle Cleanser for keeping acne at bay. It has 0.5% salicylic acid and tea tree oil, so it really removes dead skin cells without leaving your skin dry and stripped.
Blackheads occur when open pores become clogged with excess oil or dead skin cells. The top layer of the pore remains open, which results in its black color. The Dr. Oracle Peeling Stick, emulsion, and cream work wonders in combating those stubborn blackheads. The Dr. Oracle Peeling Stick is an AHA/BHA stick that's soaked in an exfoliating serum, which gently buffs away blackheads, dead skin cells, and excess sebum. You can pair this with the Dr. Oracle emulsion and the Dr. Oracle cream, which are designed for sensitive skin. They can be used on any skin type for pore care. Both are highly moisturizing to leave you with baby soft skin.
Whiteheads are similar to blackheads in that they also occur when a pore gets clogged up with excess sebum or dead skin cells. But whiteheads are harder to treat because the pore is closed up. For whiteheads, we recommend the COSRX Acne Pimple Master Patch. These little patches are a cult favorite because they help treat breakouts by drawing out the gunk from the pores. These patches are thin and clear and will stay on through showering and washing, and you can even hide them under makeup.
Moving on to inflammatory acne. Inflammatory acne can be characterized by pimples that are red, swollen, and inflamed. They're also pretty painful.
Yeah, and they're painful because they're not only caused by excess skin cells and excess oil, but also bacteria, which penetrate deeper into the skin.
You want to be really careful when treating inflammatory acne because these are the kind of pimples that can cause scars.
The first two types of inflammatory acne are papules and pustules, which happen when the walls around the pores begin to break down.
Papules are pink and tender, while pustules are filled with pus and protrude from the skin. They're usually red and filled with white or yellow heads. Products with green tea and kaolin clay work well for papules. The Repeat BioFresh mask with real calming herb is a great option for soothing the infected area. Because papules generally occur when a whitehead has become infected and lie deep under the skin, it's important to calm the skin rather than try to dry it out.
For pustules, we recommend using the Misha Speedy Solution Anti-Trouble Patch. Similar to the COSRX patches, these adhere over blemishes and protect them, helping them heal faster. Make sure that you don't touch pustules until the white or yellow head has emerged. Once it has, you can carefully remove the pus and clean the area. The last two kinds of acne are nodules and cysts or cystic acne.
Both types of acne generally need to be treated with prescription medication from your dermatologist.
Nodules develop from untreated papules and pustules, which grow larger and deeper into the skin.
Generally, a dermatologist will prescribe an oral medication called isotretinoin, which is a type of vitamin A.
This medication treats nodules by minimizing the size of oil glands inside the pores.
Cysts are like nodules, except that they occur deep within the skin and are a product of infection.
They're generally large red or white bumps that are painful to the touch.
In these cases, cysts are usually treated with isotretinoin, but in more serious instances, sometimes a dermatologist has to remove them.
Hormonal acne, like the name suggests, is linked to your hormones. They happen because of fluctuations in your estrogen and progesterone levels.
You're actually more likely to get hormonal acne after your teen years. If you're experiencing a lot of painful cystic acne around your chin and jaw area, you're probably experiencing hormonal acne. Salicylic and glycolic acid can generally be used to soothe skin and prevent hormonal acne. The Skin Food Tea Tree Bubble Cleansing Foam is a great option that contains glycolic acid that won't dry out your skin. It's important to remember, though, that hormonal acne generally comes in the form of cysts and may need to be treated by a dermatologist.
If you have tiny whitehead-looking things that just won't go away, then you might be dealing with fungal acne.
Fungal acne isn't actually acne at all. Traditional acne is caused by bacteria, while fungal acne is caused by a yeast infection.
Studies have shown that using an antifungal is the most effective way to treat fungal acne.
Yep, you can actually wash your face with an anti-dandruff shampoo or use a cream for athlete's foot.
Just make sure to patch test beforehand since these products are not made for your face.
Along with the antifungal treatment, we recommend the COSRX BHA Blackhead Liquid and the COSRX AHA7 Whitehead Power Liquid. These will keep the oils on your face at bay, and chemical exfoliants like these are very gentle and can generally be used on sensitive skin.
Seeing a dermatologist might be tough and scary, but it might just be the right choice for you.
If you've been using over-the-counter products for a really long time and you're not seeing any results, or if you have really painful acne, you'll probably want to see a dermatologist so they can diagnose the problem from the start and prescribe a really strong medication. Well, that's all for us. If you have any questions, please ask them in the comments below and we'll be happy to answer them for you. Bye!